Just always remember back to sleep. I think that's probably the easiest way to remember it. Safe sleep practices have changed over the years, but the most recent recommendation over the last decade at least has been back to sleep only. So you always want to place your infant flat on their back to sleep. You don't want to have anything elevating their head like a pillow or anything under the mattress elevating the mattress, but flat on their back to sleep. So you don't have to go in every hour to check to make sure your baby is still on their back. If you put them on their back and they roll onto their belly, it is okay to leave them that way, but always when you place them in the crib, you want to place them on their back. There's actually some very clear pictures as to why it's actually safer for them to be on their back even if they spit up. In the situation where you have a full-term healthy baby, babies instinctively turn their head if they begin to spit up. If you have a baby who is on their stomach and they spit up, they don't have the neck strength often to lift their head up out of the vomit, and they can actually aspirate the vomit. So spitting up when they're on their belly just because it comes out of their mouth doesn't necessarily make it safer. You want to make sure that everyone who might be caring for your baby gets that same message. Because safe sleep practices have changed over the years, grandmothers, aunts and uncles, and anyone taking care of your baby might have practiced differently when they had their children. And babies who are used to sleeping on their backs, who are put on their belly by another care provider, potentially not the mom, are actually at more risk for SIDS death than babies who always sleep in a different position. So you want to make sure anyone caring for your baby knows to put your baby on their back.